Welcome back to the program, Dr. Kevin Kavanagh of Health Watch USA. Good morning, Dr. Kavanagh.
Good morning, sir.
This morning we are hearing concern from the Surgeon General of the United States about the possibility of a resurgence in coronavirus infections because of the protests after the murder of George Floyd and others.
That is a very huge concern. If you look at the data, we've pretty much bottomed out as far as going down. And now in Kentucky, we're starting to uptick a little bit. And nationally, we've leveled off and starting to uptick. And this is on the nation as an average. Of course, states may do differently. So I do think that we may be into a resurgence, which is very scary for me. I was, as you know, hoping this would tend to go away with the summer and that people would be doing good social distancing, wearing cotton masks, and anything but that has happened, unfortunately.
And speaking of social distancing, you sent me a link from The Lancet, the respected British medical journal, talking about social distancing. We've been saying 6 feet here. In The Lancet, they're talking about 6 meters, which is closer to 6 yards, 18 feet instead of, and they're saying that may not be enough.
Well, and that's if someone is coughing and sneezing. Yes, the Lancet really looked at the findings of the studies that measured how far you have to be away. They said that they're very old studies, and that if you look at people that are coughing and sneezing or talking very loudly, that you may have to be farther away. And that's another reason why everybody should be wearing cotton masks. Now, if someone is not talking or talking normally, closer is fine. And the 6 feet rule will exclude a lot of the viral particles. And that is still viewed as being safe for everyday public. I will say when I say safe, I mean safer. As always, nothing is completely safe with this epidemic. But I don't think you can go around being 25 to 30 feet away from people and walking down the streets of Lexington or being in stores. That's way too far away, and that's just not practical. The study did state that the majority of the viral particles will not get past 6 feet. And of course, you need more than one viral particle to become infected. You'd be highly unlikely to be infected if you were just hit by one. It takes a number of them. So 6 feet away is still the rule that's being said by the CDC, but certainly if you can be further away, I would do that.
All right. Masks have been controversial, and you mentioned cotton masks. What's the deal with, should it be cotton masks? Should it be something else?
Well, ideally, any mask should be the best mask you could get, but the N95 masks are very difficult to come about. And if you are a member of the general public and all you're wearing is a mask, it's probably not going to offer you that much protection. So cotton masks are good to use, and you need to go online, do some research. We've got some examples at Health Watch USA of what can be used, and they can be constructed in a certain way so that they have better filtering, and they will tend to protect other people from yourself when you're talking loudly, coughing, or sneezing. And I said tend to protect because they're not 100%, but they're enough that they can help prevent spread and drive down the spread of the epidemic. There are some studies and some research which feels that through social distancing and the wearing of cotton masks, that the epidemic could slowly burn out. And that's, of course, if we get our social discord under control and that we have proper social distancing and wearing of masks. I mean, we're never going to control this epidemic if we have all this social upheaval. And that is extremely important, these issues that it's addressing. But we need to try to address this in a safe manner.
Doubters, or people who have politicized the whole outbreak or who have doubted the severity of the outbreak, have often said that the numbers that we hear, the numbers of cases, the numbers of deaths, have been overestimated. What's your opinion? Have they been overestimated, underestimated, or are the numbers we're hearing about right?
No, I think the numbers we're hearing are about right. You know, this is a very difficult epidemic to get an exact death toll on. For two reasons. You've got asymptomatic spread and inaccurate tests to measure that. You have a virus that affects almost every organ in the body, so determining causality is very difficult to do. And several weeks ago, I said there's going to be studies coming out showing what our average death rate is and compare it to what our present death rate is. And that study has come out and it was published in the Washington Post, preliminary data, and it shows that we've had at least 100,000 extra deaths. And in fact, that number was approached several weeks ago, and they're predicting 26,000 more deaths based upon that type of analysis than what you would normally expect in the United States. And what also impressed me about that data is that prior to when they started, that being on March 1st, we actually had less deaths in the United States, which means that the epidemic's effects may be even greater than what they stated. And so I think that this is going to be the most accurate way that you can actually get a global picture on what's happening with the death rates. I know that there's been a variety of different studies. There's been a recent study reviewed all the studies looking at death rates, and they went everywhere between 3% down to 0.25%. And the study concluded that, well, maybe we should be in the middle or a little lower. So I think when you're talking about a 1% death rate, that's a very good type of a statistic or estimate on what we're seeing. The Stanford study, which came out, has had a pretty big backlash in the medical literature, and they have had concerns that were expressed about it. And this included concerns on how they gathered their subjects, which was by Facebook, so that possibly people that were exposed or more concerned about it signed up. It wasn't a randomized study. There were also concerns on their statistical analysis and by the fact that they were using tests that were made in the United States or what we were using in the United States at that time. And as you know, the antibody tests were highly inaccurate, up to 50% inaccuracy. And we discussed this before. So there's a lot of concerns that that study has grossly underestimated things. And if you don't believe the death rates, then just look at the pictures coming out of Brazil, the mass graves. It's really disheartening. We've seen that also in Iran. New York City was starting to get into that situation with having mass graves at one point and makeshift morgues. So this is a very serious virus. The good thing about it is if everybody would stay inside for 4 weeks, it would all but go away. We know how to defeat this with just simple social distancing, wearing of masks, and social isolation if you're at high risk. That will cut down on the spread, and there is good research that indicates that that in itself will burn out the epidemic.
All right, we are running late here. Dr. Kevin Kavanagh, healthwatchusa.org. Thank you very much. We'll talk to you again on Friday.
Thank you, sir.